I'm Pam Seatle at King Edward Junior and Senior Public School. As kids get back to class today, the focus for many is on their health and well-being, and that is why the results of a new national study are particularly disturbing. Children's First Canada looked at regions across the country in categories, all of which paint an unsettling picture. For example, it found that 1 in 5 kids is growing up in poverty. 1 in 3 has experienced abuse. 25% are obese or overweight. Canada is the world's 5th most prosperous nation, and yet UNICEF has us ranked 25th of 41 wealthy countries for our children's well-being. So the idea of Canada being a world-leading country for kids is a myth, according to the report's author. One of the most disturbing findings is around suicide and mental health.
1 in 5 teens considered suicide in the past year alone, and half of them had a plan. And over the past decade, we've seen a 66% increase in emergency room visits due to mental health concerns. Now, that really points to us that young people in our country feel a deep sense of despair, that they have mental health concerns that are not being met in their schools, in their homes, and in their communities, and they're having to, really show up in emergency rooms to get that support. That's really putting a Band-Aid on a gaping wound.
The report broke down its numbers by region and found that Ontario has the highest rate of hospitalization of children for mental health issues, with more than 16,000 in 1 year, compared to under 7,000 in Quebec, which was in second place. While Canada First and other children's organizations are pushing for a national call to action, Sarah Austin recognizes that more resources are needed close to home and that school boards need to do more.
Our schools need to be providing mental health resources for children so that they can deal with the many challenges they're facing around anxiety, depression, self-harm. But we also need investments around after-school programs, school nutrition programs. We need to look at the whole child.
The Toronto District School Board tells us that between social workers, psychologists and other staff, there are close to 700 people supporting the board's 250,000 students, and that number has remained fairly consistent. But if you talk to parents and students, you hear consistently that more help is needed.
I think we need more resources available. I know kids who have had issues, and I think very proactive parents who can see what's going on catch it, but there are lots of times when parents aren't going to catch it, and I think kids do fall through the cracks. And I think if there is a more thorough system to help catch those kids before trouble starts, it would be very good.
Do you think that there are students that don't seek help because they think that there might not be the support available for them?
I do. There definitely are. I can personally think of people that I know of that kind of just feel hopeless when it comes to seeking help.
I'm a parent with a child who's fortunate to have access to that, but it took a lot of advocacy for anything extra for kids. And I think a lot of children experience anxiety. It's pretty commonplace, and if you don't learn the tools you need to address those issues early, you're struggling with them when you're older, and they're tougher.
Now, Children's First Canada says that the government needs to appoint a federal commission on children and youth whose sole focus will be on the well-being of kids, as well as a children's budget, so that we can see how the government is investing in our kids with complete transparency in order to ensure that the outcomes are beneficial to our kids.